6th lecture, at the next lecture in the sequence. That will be entitled Breast Cancer in Sub-Saharan Africa, Time to Raise the Stakes. And there'll be 2 co-speakers in that presentation. Omalara Fatirigan and Abiola Ibrahim will be talking on that topic. But now to today's gathering. It's my pleasure to introduce a longtime friend and colleague, Sam Dorevitch. Sam is a Chicago native and has done his undergraduate work, medical school, residencies in emergency medicine and in occupational environmental medicine and MPH education in Chicago. Given all of that time spent locally, his current research activities are mainly overseas. Dr. Dorevitch's appointment is in the UIC School of Public Health, Division of Environmental and Occupational Health Sciences, and his research focus is waterborne infections agents. He has been funded by the EPA, the CDC, NIH, and the US Department of Housing and Urban Development, the Metropolitan Water Reclamation District, the Chicago Park District, the Waldorf Foundation, the Portes Foundation, and the Bill and Melinda Gates Foundation. He has also served on state, local, and federal and international water quality committees. Dr. Dorevitch's global health work is focused on water quality and health in Western Kenya. His work is part of a platform for research developed by faculty in the Global Health Program of the UIC School of Public Health. He collaborates with several non-governmental organizations with financial support from federal and foundation grants to several of our SPH faculty. The platform, just to plug our global health program, the platform built by our SPH faculty for research in Kenya has supported over 30 student practicum experiences, including students from public health and medicine. We're very excited to hear about Dr. Dorevitch's work, further extending this network of research and expanding from beyond infectious diseases and HIV to water quality work. And with that, I'll turn the lectern over to Sam.
Thank you, Ron. I am really honored to be here and to be kicking off the UIC Global Health Colloquium series. Thank you for inviting me, and I'm happy to take questions at the end of the lecture. If there's something urgent, I don't mind if you just jump in and speak, but I'm not going to be monitoring the chat. So if your question's in the chat at the end, I'll be able to take them all. I'm going to be speaking about funding and financing of global WASH interventions. But Ron, can you see my screen?
Yes, I can.
Oh, okay, thank you. All right. So the work that I'm going to talk about has been done in partnership with collaborators at University of Illinois and Urbana-Champaign and the College of Engineering, with county government in Kisumu County, Kenya, Shemgen Engineering, an engineering and construction company in Kenya, funding from the Bill and Melinda Gates Foundation, and my indispensable in-country implementing partner, the Safe Water and AIDS Project in Kisumu, Kenya. So several years ago, I was going through a site selection process to identify a place to build a drinking water treatment system. And along the way, at one of the locations, one of the communities under consideration, we came across an abandoned water treatment system, where several years before some other researcher or donor or NGO had also thought it would be a good place to build a water treatment system and community dispensing of water, and the site was defunct. It may have had enough money to get started, but it did not have enough money to continue operating. And this reminded me of scenes in movies where, some explorer looking for treasure goes into a cave and finds the skeleton of some previous explorer who had been looking for the same treasure. And I thought that, and this one abandoned kiosk wasn't the only one. During the site selection process, I ran into 3. So this was a kind of haunting experience, and it made me wonder, is this the fate of the water sanitation and hygiene intervention that I had been planning to build with my colleagues? And what determines whether a public health intervention like a water treatment system will continue to function after the period that research funding is over? And eventually it led to other questions like, could systems like ours be built at a low enough cost and generate enough revenue from people buying water that it could become self-sustaining? And if so, could it even be improved to the point where enough revenue comes in over a period of years to recover the capital costs of starting out? I don't have the answers. I was not able to answer those questions yet about, will there be enough funding? How can we make it work and be sustained? But I am thinking about it in ways that I've never thought about accounting before. And I'd like to share with you this experience and what I've learned. And I'd be very interested at the end to hear from others in the audience who also have implemented interventions, whether it's environmental interventions or other interventions overseas, and to see, to learn from them about whether they've figured out how to sustain interventions beyond a period of initial research. So safe water sanitation and hygiene, or WASH, is a major public health challenge. There are over 400,000 children per year under the age of 5 who die from unsafe water sanitation and hygiene, primarily through gastrointestinal infections. And in many countries, it's by far the #1 cause of death under the age of 5, particularly beyond the neonatal period. And the Sustainable Development Goals includes Goal 6, clean water and sanitation, which is meant to ensure the availability and sustainable management of water and sanitation for all. And within this goal, like most of the Sustainable Development Goals, has many targets, and these are monitored over time. At the 5-year mark, there is a joint monitoring program of the WHO, the World Health Organization, and UNICEF to track progress on water sanitation and hygiene. And unfortunately, we are woefully behind. If trends from 2015 to 2020 continue, we will not achieve targets for drinking water, sanitation, and hygiene. And what this slide is showing is that we have to ramp up between double and 4-fold the effort, which means expenditures of money and resources and effort, if we're ever going to meet the Sustainable Development Goals for Sustainable Development Goal 6. So just a brief overview of water treatment. There is centralized drinking water treatment, and you see on the left side of the screen the Jardine water treatment plant here in Chicago. And it's a multi-billion-dollar site that is linked to a piped water system that brings water to our homes that's been treated and disinfected. On the other hand, in low and middle income countries, especially in rural areas, for the last 25 years, point of use treatment has been promoted. And that means adding something like chlorine or some other disinfectant or filtering the water using something like a ceramic filter. The point of use methods have the advantage of being far less expensive. They're also not as effective in disinfecting water, keeping it disinfected, and studies have been disappointing when it comes to trying to identify health benefits from point of use interventions. So what I've been working on began as a point of use disinfection method, a new one that generates ozone using solar power. And this was funded by the UIC Global Health Seed Funding Program. And this is a project that was done in Kenya. Kenya is in East Africa. Kisumu is like Chicago on a Great Lake. It's on Lake Victoria. And that's where I did this work. The reason I did it in Kisumu, Kenya, of course, is because that's where Bob Bailey has been working for 20 plus years. And because Bob is there, and because Supriya Mehta is there, Supriya, the Associate Dean of Global Health for the UIC School of Public Health, we have research infrastructure. There is a lot of institutional knowledge of local IRBs, local universities, how to get things done, a lot of information about NGOs. And Bob was able to connect me with the Safe Water and AIDS Project, or SWAP, which is a non-governmental organization, an NGO in Kisumu, Kenya, that does a lot of water sanitation and hygiene work. So over the next couple of years, I worked with funding from the Portis Foundation, comparing the solar-powered ozonation to a couple of alternative methods. And it seemed to work very well at disinfecting water, but it didn't seem like a good solution to wash challenges there, that each solar-powered water treatment system cost about $250 US, and it was only in use a couple hours a day. So partly based on Bob's insights, I began thinking about decentralized or small-scale water treatments. This is sort of a third way in between big centralized systems and small point of use in the home treatment approaches. And there are water treatment systems around the world that use generally ultrafiltration methods, and they produce water which is then sold at kiosks. It's sort of a water refill station. People can bring a 20-liter jerry can, pay some low price, usually set by local governments. So it's in Kenya, 20 liters cost 3 cents, 3 US cents, or 3 Kenyan shillings. And that's pretty affordable, even by local standards. So the idea of taking our technology, the solar-powered disinfection, was something that we proposed to the Bill and Melinda Gates Foundation. And unlike the point of use, by building a treatment system that's operated by somebody whose job it is to operate the system, it can be more sophisticated. It doesn't have to be as simple as something that people are going to do in their own homes. So it's got all of the steps of basically a water treatment plant. And the orange ozone generators are what makes the technology unique. Ozone is produced from air using this microplasma technology, and water comes out disinfected. So what I have learned is that getting research funding to build a water treatment system and evaluate its health effects is really different than keeping it going and being able to finance the ongoing operation of the project and to manage it, or to have it managed by a community. So funding is money provided usually by an organization or government for a particular purpose. So research funding is usually about testing a hypothesis, evaluating an approach, and the output is new knowledge that gets published. And the pathway to sustainability isn't straightforward. Maybe a donor, maybe a government, a policy-making body will recommend this approach or provide additional funding to keep it going. There's also donor funding. So it's not necessarily a goal of developing new knowledge, but about meeting the goals, the mission of the foundation or the organization that's making the donation. And that may include capital costs of whatever is involved in a project, like building a clinic, but it's unlikely to include the costs of maintaining and sustaining it. And that was the case with the funding that I got from Gates Foundation. So we're all familiar with the grant cycle. People think you write a grant, get money, do research, publish the results, get another grant. We also know that in reality, first you do the research, then you get results, then you write a grant to fund what you already did, then you get money to do something different. So if that were to be operative, in order to keep this water treatment system going, I would forever be writing grants to get more money to keep the system going. And as soon as that grant runs out, the system follows the fate of those water treatment kiosks that are defunct. And there are many, many examples globally of failed wash interventions that either never get built or don't work, and generally speaking, are not operating a period of years after the original funding arrived. So financing is a whole other approach. Generally, it involves borrowing money, borrowing or lending money, or coming up with money that it allows for the continued operation of something like a water treatment system. The problem is governments of low and middle income countries don't have the funds they need to, let's say, build a centralized water treatment system or wastewater treatment system. And lenders are hesitant. Lenders, even lenders like the World Bank, are hesitant to provide that kind of financing because forget about getting paid back. Sometimes the project never gets built, or it gets built, but it's no longer operated, it's not maintained. Sometimes projects do get built, but it's the wrong project. It's not what's needed by the people locally. And there's all kinds of white elephants of, things that got built that nobody ever said they wanted. So providing financing to state or county or national governments in low and middle income countries is very challenging. So I had thought about governance of our water treatment system. And That was actually a couple of the goals proposed to the Gates Foundation, was to evaluate how water treatment systems would be managed, but financing it and tracking expenditures and revenue and trying to figure out how to sustain it was not part of our proposed work. But others in academia have done kind of limited analyses of sustaining water treatment systems, including systems with kiosks and water refill stations. One was in Rwanda, where they actually built 10 kiosks. This is data from the first 9, where kiosks were built at healthcare facilities. And people in the community could come and buy water there. Another set of studies was published by the Aquapot project. And this is based in Spain, but what they've been building is in Ecuador and Mozambique. And again, a treatment system with a co-located water kiosk. The problem with what's known is that they don't consider the capital costs. The capital costs have been donated. So whether they can ever be recovered hasn't been a goal. Also, the labor costs are not accounted for. So they'll say that people who already work at the healthcare facility will operate the kiosk, so that the accounting of real costs is really lacking. So whether it's possible to build something and sustain it using revenues from operation to the point that even the capital costs are recovered is not known in decentralized WASH or really other kinds of WASH projects. So let me show you what this project looks like. You won't hear any sound at the beginning, but it'll come in. This is a 2-minute video of what's been built in Kisumu County by this project. And it's called Sola Maji, Sola meaning solar and Maji meaning water in Swahili. I'm Sam Dorevitch from the University of Illinois Chicago School of Public Health. Solamaji team members in the US and Kenya are thrilled to see this solar-powered system meeting the need for safe drinking water. Not only do community residents benefit from the water, some are employed to work at the kiosks and their salaries are completely covered by sales at the kiosks. We look forward to establishing additional and larger Solamaji systems so that communities elsewhere can produce safe drinking water sustainably.
Microplasma technology developed at the University of Illinois introduced microchip scale reactor that using the ambient air to produce ozone that can kill various pathogens in the drinking water. Furthermore, the technology using the low power, so it can be using as a battery power or solar power solutions in the remote side. And the unit is very easy to maintain by local people.
There, we ozonate the water using these EPs. This process takes around 30 minutes. Around 30 minutes to completely treat 500 liters.
John ne wachando ni pi ma watiyogo. To sani wan kod pi maler. Ne waomo pi mabor ma wanyalo tiyogo kata ma wanyalo Mamondo ne wachop kuro ne 3 kilometers. Koro sani wayudo pi machiegni. Ok wanyal tiyo gi pi aora molil sani.
Koro pigni osebedo ka tiye pok aneno rach mare nikech pigni opogore gi pige mamoko machalo kamoro mokuongo kosemanyo. En pi moro ma onge chung'. To ng'eny customers ok dwa pi chung'. Mostly ma wan go ahero ka gin motimo mana tugo nyaka sani kaka operator margi gino konyowa gi gik mang'eny nikech walose maber ni ji modho karol achak wayude gimoro mapesa bang' end of the month machalo kaka pilkoro payment.
Main issue is sustainability, and that's why when my office was incorporated, we even trained community. Right now, we even have a water management committee running the scheme. By the end of the day, when SWAP will be out of the picture, I believe that there'll be sustainability.
I also want to appreciate the technology that was used by solar purification system that ensured our people are now drinking safe and clean water. This has been a dream for so long, and our people have been taking contaminated water.
I'm going to interrupt here. Are you seeing the video?
No, we're not.
No.
I tried to send you a text message about that.
Yeah, I just got a text message. And I'm so sorry. Do you see a video now?
You check your sharing. Like you need to share your actual screen and not just the PowerPoint program. Maybe.
Yeah. Oh, I'm so sorry. And let me do that.
Before we came into business.
There we go.
I'm
You can see it.
all right. I'm going to fast forward through much of this. All right. So this is what the system looks like.
This solar-powered system meeting the need for safe drinking water. Not only do community residents benefit from the water, some are employed to work at the kiosks and their salaries are completely covered by sales at the kiosks. We look forward to establishing additional and larger Solomaji systems so that communities elsewhere can produce safe drinking water sustainably.
All right, and I'm going to fast forward to some of the stakeholders and local residents.
Ne waumo pi mabor mwanyalo tigo kata mwanyalo mamondo ne wachop kuro ne 3 kilometers. Koro sani wayudo pi machiegni, ok wanyal tiyo gi pi aora molil sani.
Koro pigni osebedo ka tiye pok aneno rach mare nikech pigni opogore gi pi mamoko machalo kamoro mokuongo kosemanyo. En pi moro ma onge chung'. To ng'eny customers ok dwa pi chung'. Mostly ma wan go ahero ka gin motimo mana tugo nyaka sani kaka operator margi gino konyowa gi gik mang'eny nikech walose maber ni ji modho karol achak wayude gimoro mapesa bang' end of the month machalo kaka pilkoro payment.
Main issue is sustainability, and that's why when my office was incorporated, we even trained community. Right now, we even have a water management committee running the scheme. By the end of the day, when SWAP will be out of the picture, I believe that there'll be sustainability.
I also want to appreciate the technology that was used by solar purification system that ensured our people are now drinking safe and clean water. This has been a dream for so long, and our people have been taking contaminated water and not very safe for human use. As we speak, people are being happy and enjoying safe water.
Okay. I'm so sorry about that. And I'm going to go back to the slide presentation now.
Before we came into business, my husband was working with a company called KRA, Kenya Rainwater Association, and they used to
Okay, sorry again. Can you see slides now? Anybody?
Yes, we can, Sam.
Thank you, Ron. Okay, so the one thing I want to show on this timeline of the process we went through to get 2 sites built is swap the NGO implementing partner and CBO, the community-based organization. This is the key to the management of the system. We established 2 registered community-based organizations, 1 in each community, and they are a legal entity in Kenya now, and they are essentially incorporated to operate the kiosk. So the systems began to operate and they were operated by the Safe Water and AIDS Project, the NGO implementing partner. And over a period of months, the operation transitioned to full operation by the community-based organization. So the NGO out of the picture, full operation by CBO. The costs are something that I want to get back to now. So initially, records were kept each day at the kiosks using pencil and paper. We were able to revise that. So because it was clear that we weren't getting accurate information, and we provided tablet computers that can get online using the cell phone network. And in pretty much real time, we now track sales of water, water quality, something called turbidity, or the cloudiness of water, is measured on site by the members of the community-based organization, and they enter it. So we're starting to get a better handle on the financial operations. Building the sites cost about $35,000 each. And that includes things like me and Sung Jin, the professor of electrical engineering who developed the microplasma technology. It includes our travel to Kenya. And the first site was sort of reconfigured from an existing kiosk that had become defunct. And the second site was built from scratch. So those cost about $35,000 each. And obviously we're learning. The goal in construction was not exactly to make them modular and prefabricated. The operating expenses at this point are about $100 a month for the CBO. So the main cost is paying the kiosk operators. It's 8,000 shillings a month. And if there's one operator, he or she gets all 8,000 shillings. If 2 people split it, then it's sort of 50-50. But then there are other costs like independent lab testing to certify that the water quality meets local drinking standards. There's a business permit that the CBO has to pay. There's, in theory, some marketing that happens. So that's about $100 a month. But then the NGO is still supported because they have a laboratory. They go out to the sites, they collect water, they test it. Running a lab has expenses like personal protective equipment, waste disposal. Getting people from the NGO to the CBO cost money for transportation. So the total monthly operating cost for the NGO is $73. The revenue is tracked, I would say, imperfectly. We do have records for cash, and we also have records for something called M-Pesa, which is a cell phone-based cash transfer platform. You don't need a smartphone. If you have a dumb phone and you can get online, you can buy things throughout East Africa using M-Pesa. So we have better records for M-Pesa than we do for cash. And water is sold in two ways. What you see here is a water vendor at the first site with a cart that is loaded up with 20-liter jerry cans, which are then brought to customers. And there's a big markup in price because the water vendors buy it for the same 3 shillings as people who buy water as water refills themselves at the kiosk. But depending on how far their customer is from the kiosk, they charge them an increasing amount. So the water can get expensive if you buy it from a vendor, but it's obviously good for us to work with the vendors rather than compete with the vendors. There's also seedlings. We've one of the staff at SWAP knows a whole lot about plants and agriculture, and he set up gardens and taught the community-based organization how to maintain them. And it's like a traditional gift that if you go home to your family in the village on the weekend, you may bring seedlings, little tree saplings and plants. So these are sold at both of the kiosks. There's some other economic activity that takes place there. There's something called table banking and very small micro-entrepreneurial enterprises. But those funds don't go into the kiosk. Those are sort of kept by the people who do those activities. And then there's car washes. People who have cars and trucks and motorcycles are willing to spend way more money on keeping their car or motorcycle or truck nice looking than they are on spending money on water. So we could get 200 shillings from one car wash. And there's, again, this entrepreneurial effort to have car wash activity take place using our water pump and using the river water that we have access to, and then the money goes back into the kiosk. And I think if this really took off, it would greatly increase our total revenue. But the revenue is $146 approximately, so that's more than enough to meet the operating costs of the community-based organization, but not enough to also support the NGO in kind of serving as a backup and technical resource for the kiosks. So could we recover capital costs? Internal rate of return is a way of measuring that. And the short answer is that in theory, if we could keep construction costs about constant, but triple the sales, after 15 years, we would recover all of the initial capital costs. So that means we need to be operating in bigger communities at larger scale. The construction cost would be about the same. Even if we're producing 3 times as much water, we would need probably more operators working. But I am sure that the capital cost can come down by making things sort of prefabricated and modular. There are a lot of places, there are a lot of efforts to build things out of shipping containers, things that look like, things that those big, looks like a truck that gets loaded onto a container ship. Those are used for all kinds of purposes. And I think if we started using those, it would greatly bring down the costs to the point that we could recover the capital costs. So in short, this system is promising. It operates off the water grid. It doesn't need pipes. unlike other decentralized systems that are dependent on piped water, it's off the electric grid, and anybody who's lived or worked in lower middle income countries knows that power failures are common. Because it's solar powered, that's not at all an issue. It helps meet a different sustainable development goal, affordable and clean energy, in that there's no fossil fuel combustion. Even the pumps that move water from the river to the treatment system are solar powered. We leave groundwater in the ground, unlike most of the projects that involve boreholes, where groundwater is being depleted. We're using river water that's very, very dirty, extremely high E. coli levels at the beginning, but it comes out essentially E. coli free, not 100% of the time though. Sometimes we get 99% of the bacteria out, but it is not completely bacteria free 100% of the time. So this is my experience and things that I've been thinking about in terms of how to go from funding something to, financing it in a sustainable way so that it continues to live on after the period of funding from a government research agency or a donor foundation is over. I'm sure there are people on this conference who have more experience than I do in trying to sustain projects in low and middle income countries, and I'd love to hear your experience. And I will, Jean, I think should I open up the chat window at this point? I will open the chat window at this point.
Yeah, Sam, I'll try to curate the chat a little bit and
Thank you.
Channel you questions. There is one from Michelle Hathaway. It says, is that IRR per site or for more than one site?
That's for one site. So if we had one site that was, producing and selling three times as much water, but essentially at the same cost, that one site would be able to recover the initial investment in 15 years. Good question.
While we're waiting for the chat to populate, I'll take the, I guess, moderator's prerogative, and I'll ask, the NGO that oversees this is called Water and AIDS, and I'm wondering if there's any integration within that organization of the AIDS part of that. We know that HIV infected people are more susceptible to severe outcomes from enteric infections and so forth. And I'm just wondering if there's any attention to areas where prevalence of HIV might be higher, or to what extent there's integration between the AIDS part of the organization and the water part of the organization.
Yeah, so the organization was started about 15 years ago, and AIDS is highly prevalent, of course, in sub-Saharan Africa, and less antiretroviral regimens were available then, and preventing enteric infections among people with HIV/AIDS was one of the main areas of focus of the organization. So making sure people with AIDS had safe drinking water was where the NGO began. I would say over time, it's less, they're less integrated. They do mainly programs like safe water in schools, healthcare facilities, latrines. Right now, they're very involved in COVID, because how can you have hand hygiene if you don't have safe drinking water? So they're very busy now. They make hand sanitizer in the laboratory where they test the water for bacteria, and that hand sanitizer is marketed throughout the community. But it's not so integrated with HIV management as it was 15 years ago.
Since you brought up COVID, we know that COVID is disrupting healthcare of all types in all countries that are affected by COVID. And I'm wondering if it has had a disruptive effect on your ability to garner attention or funding for these kiosk systems and so forth, whether, I don't know, people's attention is diverted or funds are diverted for COVID mitigation.
Yeah, I wouldn't say that that's really been a barrier or a hurdle. If anything, just the way that SWAP is presenting itself as an anti-COVID intervention, through providing safe water for hand washing and providing hand sanitizer. They're very busy. They've got a lot of funding right now. It's been a challenge for me in terms of travel to Kenya has been difficult, but I was there in April. It also means that, the local government, the county government, was going to build that third treatment system that would be much bigger. They haven't put out a tender yet for, asking contractors to provide estimates of costs. And I think they're diverting so much of their own funds to COVID that they may or may not build a treatment system, but they would be our first customer as, in this financing model, as opposed to getting funding from outside. It looks like Mark has a question about building more businesses. So yeah, that is a possibility. Both of the current kiosks are located in market areas. Without wanting to compete with existing people in those markets, we do work with them. There's something called a market members committee, and all of the people who sell things in the market have been involved in, or the market members committee has been involved in setting up the kiosks. There are people who have tried setting up food stalls, and we'll see where that goes. One of the challenges is seeing the community-based organization, take ownership to the point that they say, we need to be entrepreneurial, we need to try new things to bring in revenue. But the NGO is trying to promote that sort of activity. Health products are sold at the water kiosks, though. We do sell malaria, mosquito nets and feminine hygiene products and soaps and all kinds of hygiene related products. But the revenue doesn't go to the CBO. That's basically sold at just slightly above cost. And the person who does the selling keeps the revenue or keeps the profit.
I don't see any more questions in the chat, so I thought I'd open the proceedings up to what you alluded to earlier in your talk, the idea that people could share their experiences with creating sustainable projects overseas. So I would invite the audience now, if they do have experience or anecdotes to relate in that vein, to just unmute and speak up.
You'll have to raise your hand to be unmuted. Anybody?
There is one other question in the chat. Great presentation, thank you. You mentioned that community members are charged based on the distance from site, meaning the farther they travel, the more they are charged. Is that correct? Do you know if that works as a barrier or deterrent to expanding access to safe drinking water?
Yeah, no, sorry for the confusion. The kiosk does not charge anybody based on distance. If somebody comes to the kiosk, they are charged a price that's considered fair and that's fixed by the local community, regardless of how far they travel. However, there are water vendors who purchase the water and then load up their carts with jerry cans of water and deliver them to customers. And they charge depending on distance. So that is a barrier, I'm sure. And that's why most people don't get their water from water vendors. But if somebody has sort of disposable income or has difficulty carrying the water, then maybe that's an option for them. But that is not, the water vendors are independent of the project and we don't set those prices at all.
Question, what percent of the local population is served by this facility?
That's a good question. The second site is in a more rural area in a town called Mugruk, which is a town of about 1,000 people. Or town is probably an overstatement, but a low density sort of village area in a very agricultural part of the county. And I don't know what percent is served. I would estimate 20 to 30%. The first site, which is in a much larger town of about 10,000 people, Ahero, I don't think we reach 5% of the population. And partly that's because some people get groundwater there. They do have groundwater wells, boreholes, but people don't like it. It tastes salty. Colleagues of ours at the School of Public Health, like Maria Argos, they do work on groundwater contaminated by naturally occurring metals like arsenic. We did test for arsenic and it's not present. We tested for iron and levels are low, but there are naturally occurring salts that are in the water and people don't like the taste, but a lot of people continue to get groundwater, which is basically free. There's a Catholic mission, Catholic Church mission in the community, and I believe people can get groundwater for free in jerry cans through the church.
There are no other questions that I see. I was wondering if you could talk about the focus of your talk and your work is water, but there's more to wash than water, as you showed us early in your talk. I'm wondering if you could comment on other aspects of hygiene and the wash paradigm that are in play or being developed or lack thereof in these communities. For example, are there latrine systems in place in these villages or places? If you could give us sort of an overview of that, that would be great.
Sure. So Kisumu County is pretty forward-looking, and if you want to build a home, no matter how simple, you have to have a latrine. So that's really good. It doesn't mean that people necessarily have a hand wash station outside of their latrine. If they do have a hand wash station, it doesn't mean they have soap. And if they have a hand wash station with soap, it doesn't mean that everybody in the family uses it. There are animals all around. So especially in Bangladesh, there's been a lot of research on multifaceted approaches to, water sanitation and hygiene all together. How to provide education, incentives, hardware so that people have hand wash stations and soap, and a latrine and a way to get safe drinking water. And, the results are kind of disappointing. It doesn't seem that these point of use approaches are very effective. There's still loads of bacteria on the hands, like enteric pathogens on the hands of children. They do these studies where they have kids stick their hands in a plastic bag with saline or sterile water, and then they culture to see what's on children's hands. And these interventions, no matter how well thought out they are, don't seem to be super effective in reducing rates of childhood diarrhea, in reducing rates of childhood stunting due to enteric infections. So that's one of the reasons that I think decentralized approaches that more effectively eliminate bacteria and provide it in like a narrow mouth jerry can that like a kid can't stick their hand in the drinking water is important. Sanitation is still really lacking. Even if there's a latrine, there isn't a wastewater treatment system. Latrines need to be emptied. Part of Bill Gates's effort at building a better toilet is trying to figure out, without a centralized wastewater treatment system, is there a way to sort of treat wastewater on site effectively? And I think we're still pretty far from having systems like that in low and middle income countries.
Well, there are no further comments or questions. I'd like to thank Sam for this excellent and thought-provoking talk. And I would like to again remind the audience that on October 6th at 12, there will be another colloquium, and please join that one as well. Jean, I don't know if you have the flyer prepared for that one to show the audience at this point, or? Thank you, Jean. So I won't read this off again, but you can all see that we're in for a very nice talk on October 6th, and just again extending that invitation to attend. Thank everyone for attending today, and of course, major thanks to Sam for being our speaker and giving such a thoughtful talk.
Thank you, Sam.
Thanks, Jean. Thanks, Ron. Thanks, everybody, for listening.